Hello, this is Diksha Jain, and here I am presenting the most common neurological topic, that is the Parkinson's disease. Parkinson's disease can be held from any of the age, but it is most common from 40 to the 60. So, now coming to the definition of the Parkinson's disease. So, Parkinson's disease is a chronic and progressive neurological disease. So chronic means it is that from the long duration, and from progressive we comes to that it is getting aggravated day by day. We comes to the pathophysiology. In pathophysiology we will know that there is basal ganglia that controls the body's movement, and in basal ganglia substantia nigra is present and there dopamine is present. So in Parkinson's that cause the decrease of the dopamine, and hence the degeneration of dopamine neurons occurs that cause the loss of movement of the body. So now we come to the causes. The most common causes are the genetic and hereditary. The some more common causes are the head trauma, injury, and the environmental factor. Now we comes to the clinical features, that is the signs and symptoms. So it is from the synonym, that is the TRAP. So TRAP. T for tremor, R for rigidity, A for akinesia, and P for postural instability. Tremors are present of two types, intentional tremor and the resting tremor. So in Parkinson's, resting tremors are most common. Rigidity means the inability to bend or to force out. हम कोई भी मूवमेंट करने में हमें बहुत ज़्यादा ताकत लगेगी क्योंकि वो परफॉर्म नहीं होगा. सो फ्रॉम फ्लेक्शन to extension, this comes to the corbal rigidity, and from extension to flexion, this comes in the lead pipe rigidity. So corbal rigidity is most commonly present in the upper limb, and lead pipe rigidity is most commonly present in the lower limb. Now we comes to the akinesia. Akinesia is the slowness of movement. मीन्स पेशेंट धीरे धीरे छोटे छोटे कदम चलता है बिकॉज उसको एक डर होता है कि वो गिर ना जाए चलते. सो द पोस्चरल इंस्टेबिलिटी, जब पेशेंट का पोस्चर एकदम पुअर हो जाता है तो उसको इंस्टेबल फील होता है जब वो वॉक कर रहा होता है या फिर कोई भी मूवमेंट परफॉर्म कर रहा होता है. सम मोर क्लिनिकल फीचर्स आर द मास्क फेस, मीन्स उसका जो फेस होता है वो एकदम एक्सप्रेशनलेस होता है, एंड द डिप्रेशन, इमोशनल चेंजेस, person feels these types of the changes. And now we will come to the stages. This is the most important कि हम ये जाने, because we have known in the definition that this is a progressive disorder. So there are 5 stages. In 5 stages, first is the tremor. जब हम सबसे पहली बार पेशेंट में अगर ट्रेमर दिख रहे हैं, that is the first stage of the Parkinson's. And now we comes to the more stages. The second stage is the postural instability, means the stoop पोस्चर, जो उसका पोस्चर इम्बैलेंस हो रहा है, उसको बॉडी का पोस्चर बिगड़ रहा है. स्टेज 3, द बॉडी पोस्चर गेट डिस्टर्ब बट इट ऑल्सो कॉज डिफिकल्ट इन वॉकिंग. उसे इंस्टेबिलिटी फील होगी चलने में और आगे बहुत सारी चीज़ें करने में, उसके इंडिपेंडेंटली वो ये सब चीज़ें परफॉर्म नहीं कर पाएगा. नाउ कम्स टू दिस स्टेज 4. इन स्टेज 4 देयर इज लॉस ऑफ वॉलेंट्री कंट्रोल मूवमेंट्स, मीन्स वो वॉकिंग तो नहीं कर पा रहा है बट उसे बहुत सारे वॉलेंट्री मूवमेंट जैसे कि गेटिंग अप फ्रॉम द चेयर, बेड, क्लाइंबिंग द स्टेयर्स, ये सारी चीज़ें करने में भी उसे बहुत ज़्यादा लॉस ऑफ वॉलेंट्री मूवमेंट हो जाएगा. एंड नाउ कम्स टू द स्टेज 5, दैट इज द बेड रिडन स्टेज. द पर्सन गेट्स completely bed ridden. Investigation means doctors perform various types of the testing so that he can diagnose that it is a Parkinson's or not. So in medical history he will check for the medical examinations, vitals, and various types of the history such as BP, diabetes, thyroid, and many of the investigations. And after that he will come to the neurological examination. In neurological examination, muscle strength will be checked, weakness, coordination, and balance. These all things will be checked. Some test that is the UPDRS, Unified Parkinson's Disease Rating Scale, and PET scan, PET scan, that assess the dopamine level, transport level in the brain. So after all the investigations and examination, the doctor will come to the treatment. In treatment, he will firstly start with the anti-tremor medications that will control the tremors of the patient, and after that tranquilizer and antidepressants for the depression and a better sleep. And after that, of course, a physical rehabilitation is must, that will be performed by the physiotherapist. With the physiotherapist will plan his treatment with the aims and goals for the better independent body and a voluntary control with a balance and coordination and a good postural stability. Thank you.